Ingram. He's an orthopedist with Erlanger, and we're going to talk about joints, particularly your knees. We'll start at the knees and work up, Doctor. About 7 million people in this country are living with total hip or knee replacements. That seems like an awful lot.
Well, there's approximately 700,000 to 800,000 that get total joints a year. And if you total that up with people living much longer, then it adds up after a while.
What about, is there an age cutoff point for the hips and knees, or just the knees?
As far as elderly or young?
Yeah.
The oldest person I ever did was 97 years old. She was physiologically much younger. She rode her large tricycle bike around her where she lived, and she just did extremely well with that.
Everybody's different, so...
Everybody's different. I think you really have to look at their physiologic age and how active they are as far as what you advise them to do moving forward.
What about, you mentioned children there a moment ago. Children have those
Children,
problems,
it's fairly rare to do that. Sometimes, for example, they might get a problem called avascular necrosis, where the bone and cartilage dies in their joint for a variety of reasons, like sickle cell disease, or maybe they took a lot of steroids because they had rheumatoid arthritis when they were children, and it becomes painful, and to the point that the joint gets destroyed. Then you don't have much to offer them potentially as that. We used to do fusions many years ago, but most people don't accept fusions anymore as a method to get around.
Yeah. Some physicians, I've been told about, they do a partial knee replacement. Is that the better thing to do, or?
Well, there are basically a couple different partial knee replacements. One, there are a lot of people that have knee pain underneath their kneecap. So there's a replacement for that. And then there are also partial replacements for one side of the knee or the other. The most often side done is the medial side of the knee, and the whole idea of that is to allow them to get pain relief but still be able to move ahead with a total joint replacement maybe 10 or 15 years later.
Are there any other alternative ways of taking care of this problem?
In the really young, a lot of times what they'll do is try to do a cartilage type transplant, where they'll take either their own cartilage, although you can only do smaller grafts, and then if there are larger defects, you can take allografts, meaning cadaveric type specimens, and match them to their knee and then try to replace them that way.
What's the recovery time if you have to have a total knee replacement?
Nowadays, people are up and walking the same day they have surgery.
Wow.
They will often be out of the hospital in 2 to 3 days. In fact, we just had a lecture about this at our grand rounds, talking about outpatient joint replacement. A lot of that depends on the patient themselves and how well they can do their post-operative pain control.
But if they start having some pain, be it hips or knees, it's pretty obvious you're going to have surgery sooner or later, aren't you?
Not necessarily.
Oh, really?
If they come in my office, I'm going to examine them obviously and look at their x-rays. And I want to make sure that they have tried non-operative care to a great extent, because there are risks with joint replacement, and you want to make sure that they are mentally aware that they've tried everything else and that this is really the only way to proceed as far as relieving their pain.
Good information, Doctor. Thank you very much. If you want more information, University Orthopedics at Erlanger, 979 East 3rd Street, Suite C220. Phone number is 267-4585. Or you can go online, erlanger.org/University Orthopedics. I got it all in.
Thank you.
Thank you, sir. Appreciate it very much.